Sizewise Shuttle Series Advanced is the ultimate transitional item designed for use in conjunction with rehabilitation, examination, and transportation. The fully electric, patented Shuttle Series Advanced provides for safer patient handling and transporting, as well as aids in the prevention of care provider and patient injuries. With the touch of a button, the Shuttle Series Advanced transforms from chair to stretcher position and is perfect for use with a lateral transfer device to assist with patient ambulation. Whether simply getting a patient up out of their hospital bed and into the shuttle to sit for the first time, or utilizing the shuttle to promote patient ambulation, the psychological benefits that the shuttle offers a patient are immeasurable and ultimately help get patients one step closer to going home. Sizewise offers the shuttle in two size options. The Shuttle A series accommodates a safe working load up to 650 pounds with a seat width of 25 inches. And the Shuttle B series accommodates up to 1,000 pounds with a seat width of 31 inches. To aid care providers in patient transport, both shuttles are equipped with drainage bag hooks on each side, an IV pole that can be located in one of the 4 IV pole holders located on the shuttle, and an oxygen tank holder. Additionally, the Shuttle B series comes with a storage basket. The Shuttle Series Advanced are designed with low friction and shear, 4-way stretch seat back, armrest, and leg support covers. These covers are not only easy to clean, but are free from harmful chemicals of concern. Visco-elastic memory foam seat back, and armrest cushions are designed for patient comfort, ensuring proper weight dispersal, envelopment, and maximum pressure redistribution. Easily adjustable armrests allow care providers to modify armrest height and increase the patient's comfort level while seated in the shuttle. The armrests act as a side rail when the shuttle is in the stretcher position and can be used by patients to assist care providers during adjustments or repositioning. Height adjustments can be made by twisting the knob to loosen the armrest and move to the desired height. Always ensure the armrest is securely locked in place before leaving the patient's side. Adjustable and independent articulating leg supports allow care providers the ability to treat wounds and other ailments on a patient's leg while they are seated in the shuttle. Care providers can elevate the shuttle to a safe working height, sit directly in front of the patient on a chair or stool to provide treatment, thus reducing the amount of strain on their back. To raise or lower leg supports, push lever forward to elevate and pull lever to release. Extending and retracting the leg supports allows for greater accommodation of patients of varying heights and provides greater patient comfort and sense of security while seated in the shuttle. To extend or retract, push the release lever and adjust to the desired position. Footrests should be raised prior to beginning patient ambulation. The shuttle comes equipped with 2 removable ambulation poles to be used by the patient for support during ambulation. To remove the ambulation poles, press the push pin at the bottom of the pole and lift up. When not in use or during lateral transfers, the ambulation poles are to be stored on each side of the shuttle between the front and rear casters. The shuttle features 6 independent swiveling casters, allowing for ease of transport, regardless of the shuttle's position. The brake and steer casters are located at the back of the shuttle. Pressing the brake pedal forward locks the wheels in place, securing the shuttle from undesired movement. The wheels should be in the locked position before operating the shuttle. In the neutral position, all wheels spin independently, making the shuttle ideal for use in rooms without a lot of space. With the pedal pressed back, the rear casters are engaged in the steer position, allowing for transportation in the stretcher position. Using the push bar, the shuttle can be easily maneuvered when in the chair or stretcher position. To transition the push bar into the desired position, press the release latch and pivot bar until locked in place. When the shuttle is in the chair position, the push bar may also be used as a patient trapeze, providing the patient with greater independence and control, as well as assisting care providers during patient repositioning. Prior to operating the shuttle in any position, the patient should be securely fastened using the adjustable seatbelt. Using the 8-button control pennant, the care provider can position the shuttle into a stretcher, a chair, recline, or seat assist positions. Elevate the seat up or down, and when in a stretcher position, place the patient into Trendelenburg or reverse Trendelenburg. All Sizewise hand control pennants are designed consistently to make transitioning between products as seamless as possible for care providers. The control pennant features a clip on the back to allow it to be hung out of the way when not in use. Prior to utilizing the shuttle, verify that the unit and battery power switches are in the on position. In the stretcher position, the shuttle is ideal for lateral transfers from a patient's bed or other type of procedure table. Additionally, with the ability to adjust the height in stretcher position in its radiolucent seat back, the shuttle can be utilized as a procedure table, thus limiting unnecessary patient transfers. An exam paper option is available on the shuttle. To reduce the risk of care provider or patient injury when performing a lateral transfer, it is recommended the item the patient is being transferred to should be slightly lower than the item they are being transferred from. To raise or lower the shuttle to the proper position, either press the Elevate Up or Down button on the pennant controller. Before transferring a patient onto the shuttle in stretcher position, verify that the head section of the shuttle is at the head section of the bed. Also, be sure to raise the opposite armrest into a side rail position. Remove and store the ambulation pole on the transfer side, leaving the pole in place on the side with the raised armrest for added safety. Lock wheels in brake position, flip the push bar up, adjust leg rests accordingly based on the patient's height, and move the seatbelt to the side. Once the patient has been transferred onto the shuttle, remember to securely fasten the seatbelt around them and raise the other armrest before maneuvering the shuttle into the next position or transporting the patient through the facility. Once the patient is secure, gradually move shuttle into the chair position or articulate the patient into Trendelenburg or reverse Trendelenburg, depending on the patient's course of treatment. For increased safety, be sure to flip the footrests down before articulating the shuttle into either position. Using the patient controller, articulate the shuttle into Trendelenburg or reverse Trendelenburg. However, patients should not be transferred when in these positions. Using the control pennant, press the chair button to transfer from the stretcher position. Footrests should be in the down position to help keep the patient in a seated position and provide them additional security as the shuttle transitions into the chair position. The leg rests will remain in the desired height at which they've been set and can be independently adjusted to clinical preference and patient comfort at any point during the transition. Also, as the shuttle transitions into the chair position, press and release the push bar, moving it to the rear of the shuttle so it is available to use during transport. Should the push bar be needed to assist with patient repositioning, leave in place. If an IV pole is being utilized on the shuttle, ensure the bag or pump is always positioned facing outward, especially before transitioning the shuttle from stretcher to chair position. Once in the chair position, the shuttle offers care providers a number of treatment options. Using the shuttle as a bedside chair helps keep the patient out of bed longer, thus improving their psychological well-being and helping get them one step closer to going home. Armrests and leg supports can be adjusted for increased patient comfort or, depending on patient condition, can assist in treatment. Care providers are able to adjust the shuttle into a reclined position by pressing recline on the pennant controller. In the reclined position, patients are tilted back, reducing their potential fears of falling forward or out of the shuttle, increasing their sense of security. Additionally, bariatric or respiratory patients benefit from being in the reclined position by reducing the weight felt on their esophagus, chest, and lungs when in an upright seated position, making it easier for them to breathe. The shuttle also allows care providers the ability to keep patients out of bed longer while staying in accordance with the facility's turning protocol. Care providers can make slight adjustments to the shuttle's positioning to redistribute pressure points on the patient's body, reducing the risk for pressure ulcers. Not only does the seat assist position aid care providers in redistributing pressure points on the patient's body, it is also key in helping to mobilize patients from the shuttle. Before starting the ambulation process, the shuttle must be in the chair position and the ambulation poles should be returned to their holder at the front of the shuttle. To lock ambulation poles in place, twist the pole in the holder until the pin clicks. Also, raise the footrests so they are out of the patient's way. With the shuttle in the chair position, the patient should be in the lowest position. Care providers should have the patient move forward in the seat, leaving the seatbelt buckled to provide patients with a sense of security as they begin the ambulation process. The seat assist function should then be used to gradually tilt the seat forward to a point where the patient's feet can be firmly planted on the ground. If the patient has the ability to stand, they can use the ambulation poles for support as they raise themselves off the shuttle seat after unbuckling the seatbelt. If the patient is unable to pull themselves into a standing position, the care provider can maneuver the shuttle using the seat assist, raising the elevation until the patient is in a standing position without having to lift the patient, risking injury to them or the patient. The patient should remain buckled into the shuttle until they feel confident standing on their own. At that point, the patient or care provider can unbuckle the seatbelt, grasp the ambulation poles, and pull themselves up. Once the patient is standing, they can transition to a Sizewise walker and begin to take their first few steps. After unlocking the shuttle's brakes, the care provider can follow closely behind the patient with the shuttle, providing the patient with the ability to quickly sit back down should they need to.
The shuttle can be equipped with an optional power drive system to aid in patient transportation and reduce the risk of injury to care providers. The power drive system helps navigate the shuttle on smooth floors, thick carpet, and even uneven terrain. The power drive control is mounted on the push bar and can be utilized in either the chair or stretcher positions.
To operate the power drive, check to ensure the shuttle is unplugged and the casters are in neutral position, then press the on button. The power drive will engage, making a humming noise as the center wheel slowly drops to the ground. Once the power drive wheel is down, use the toggle switch to select forward or reverse. The power drive features variable speed selection, indicated by the international symbols turtle for slow and rabbit for fast. To select the desired speed, turn the dial. Speed should be set to a minimum position before engaging the power drive to prevent risk of patient or care provider injury or damage to the shuttle or other property. To move the shuttle forward, pull either the left or right acceleration control throttle on the power drive control unit. If the throttle is released, the shuttle speed will decrease to 0 and a brake will activate.
When engaged, the power drive will begin gradually to ensure the safety of the patient and care provider, working up to the selected speed. Care providers do not have to actively push the shuttle when the power drive is engaged. They only need to steer the shuttle in the desired direction of travel. To increase or decrease the speed of the shuttle while it is in motion, adjust the speed dial. To move the shuttle in reverse, release the throttle and press the toggle switch to reverse. Care providers should take extra care when operating the shuttle in reverse.
The power drive controller also includes a battery charge indicator, which indicates when the batteries are in need of recharging, as well as the indicator can assist with troubleshooting of the power drive should an issue arise. When the shuttle is not in use, it is recommended that it be plugged into a wall using the retractable power cord. The battery indicator, located on the patient left side of the shuttle, will indicate the level of charge the shuttle battery has available. When fully charged, the amber LED battery indicator will be fully lit. As the battery charge drops, the lights will diminish from right to left. Should the battery be drained or lose charge during patient transport, there is an emergency release button located under the patient right side of the shuttle that will automatically disengage the power drive when pressed, allowing care providers to then manually push the shuttle. The quick reference guide located in the pocket on the back side of the shuttle provides a reference for basic operational functions.
For additional information on the Shuttle A or B Series Advanced, please consult the Sizewise Shuttle user manual or contact your Sizewise representative. The Sizewise Shuttle is unique and exclusive to Sizewise, and like all our products, is proudly manufactured and assembled in the United States. Thank you for choosing Sizewise.